Wherever you are, I would like to welcome you to Let's Talk with Pastor Ngwaru show. On this particular show, we address marriage, family, we address life, we deal with the business, leadership, development. Um, it's a one-stop shop for everything. And on this particular day today, we are looking at mental health and worry. Mental health and worry. And sometimes when you hear the word mental health, just to hear the idea mental health, some people tend to get so much worried. They want to distance themselves from that idea. It seems to be stigmatized. I don't understand why. But tonight I have my guest panelists, professionals in their own right, who are coming from that kind of industry, the helping industry. They are going to help us to desensitize and demystify this concept so that it's something that we can work with, something that we can love to talk about and benefit from. I am going to allow you as viewers to be able to come through with your questions as usual and also your comments. We are going to reserve about 30 minutes of engaging with you. So you need to post your questions and you also need to put in your comments over there. I am going to allow at this stage my panelists to self-introduce. So they're going to tell us exactly who they are, what is their line of specialty, what do they do in that specialty, and what have you, and what institutions are they coming from. You forgive me, we seem to have feedback in the system. Our engineers, please, behind the scenes, if you can help us, please, we'll appreciate that greatly. So let's start with you, Jerry. If you can tell us exactly who you are, what's your specialty, and exactly where are you coming from?
Thank you, Pastor Ngwaru. I'm Dr. Jerry. I'm a psychiatrist. That's a doctor that did my normal medical training and then specialized in psychiatric illnesses. I've been working in this specialty for more than 20 years now. I'm also the medical director of Vista Psychiatric Clinic here in Pretoria, and married with 4 children, and for a wide variety of background where I come from, and the stories that sort of influence my thinking.
Beautiful. Thank you. Welcome to the program.
Thank you.
And let's go to Kibu.
Good evening. I'm Prof. Kibuhile Mukwena. I'm a public health practitioner and academic and researcher. I am in social and behavioral health sciences, and my niche area is in health promotion. The relevance for this particular program today is that I'm also an NRF research chair for substance abuse and population mental health. So I am involved in looking at mental health of groups of people in terms of research and also promoting population mental health. Thank you.
Oh, that's beautiful. Welcome, Kibu, to the program. And over to you, Mabel. Who is Mabel? What do you do? What's your line of specialty?
I'm Dr. Mabel Khadebe Rapiti. I am a counseling psychologist. I have a background of lecturing at 3 universities. I am now in private practice. I am married to Pastor Rapiti. I therefore have a Christian background that influenced my thinking as well.
Beautiful.
I have an interest in this topic because at the core of most problems that are experienced by people that I help is worry. Worry and fear.
Beautiful. Beautiful. We want to welcome you, Dr. Mabel, in a very special way to our program here. Maybe to quick start our discussion here, mental health, is it suffering from stigma as a concept?
Yeah, very much so.
In what sense?
The WHO mentions this as the one of the third highest reasons that people don't go for treatment or don't seek treatment.
Mm-hmm.
And the stigma it's driven by lack of knowledge, a lack of understanding,
Mm-hmm.
and the fact that we can't see someone's brain.
Yeah.
And the specific mental illness affects our emotional networks.
Mm-hmm.
It doesn't affect our physical networks like Parkinson's or if you had a stroke. So people can't see the inside, and that's why they really struggle with it.
Mm. Okay. No, that's
Yes,
right.
and the misunderstanding and lack of knowledge about mental health also stems from various thinking ideas. For instance, some people think that if you are mentally ill, it means you are stupid or you are demon possessed and things like that. And so there is this fear about mental illness. That is why when people are struggling with mental disorders, they want to hide it and they are even reluctant to seek help because of the stigma. So it is something that really needs to be addressed so that a lot of people can start living their life, getting help, and getting functional.
Okay, no, that's beautiful. If you can check all of us, if there are other batches that are alive, let us switch them off. We continue to get feedback. Otherwise, it will interfere with our broadcast tonight. And those of my engineers behind the scenes, if feedback is coming from our mic here, may you switch off that system so that at least we can be able to be heard by those that we are trying to serve tonight. Thank you very much. Now, is this the reason why when somebody says you need to see a psychologist and people feel like, is there something wrong with me? A feeling of, what have you found? Why should I see a psychologist? But when you say, may you go to a physical doctor or to a medical doctor, oh, they have no problem. But the moment you say you need to go and see a psychiatrist or to go and see a psychologist, people feel like, I think you've seen something terribly wrong with me and whatever. Mabel, what do you say there?
Yes, yes, it is true. It is true. And it is mainly because of ignorance, as Jerry highlighted earlier on. People do not understand the role of a psychologist, what is psychology, and all that. They simply associate it with mental illness. Actually, the extreme part of mental illness. When you just talk to a psychologist, then it's mental health, then it's extreme mental illness. You know, when you cough, you have flu. But with mental illness, when you cough, people do not simply say you have TB. They don't conclude, they don't go to the extreme and say you have TB. But with mental health, when you have a minor issue, mental health issue, then they go to extreme. They see you as real crazy. And therefore, when you see a psychologist, they conclude you are crazy. So people don't like to see psychologists because psychologists are crazy. They don't understand that there could be mental health issues that need a psychologist.
Yeah, Mabel, in my culture in Afrikaans, we call it a spiritual illness. If you translate it directly, if you've got a mental illness, we say you've got a spiritual illness. And my experience has been in South Africa, we tend to spiritualize mental health and mental illness. We say, we tend to oversimplify it. And we, instead of acknowledging the complexity of us as human beings, we want to make it down to that we just one thing, we just spiritual, and we forget that the Bible says we are actually social, physical, emotional, and spiritual.
Okay. Okay, no, thank you. Now that we are talking about mental health and worry, how do we define worry in terms of mental health? How does it present itself? How does one know I'm in this state of worry?
I like the fact, Pastor, you link worry and mental health with each other. It's a normal function. We need worry. It's a given ability to see possible problems coming our way, and it helps us avoid those problems.
Mm-hmm.
And we tend to think that worrying is abnormal.
Yeah.
But in its essence, it's normal.
Mm-hmm.
And it actually makes us healthy and keeps us healthy. I don't know about the other panelists who they want to comment on that, because it can go up to an illness as well, to the other side of the spectrum. That it's not part of normal; it's an illness.
Yes, we do need a certain amount of worry because it alerts us of what can possibly go wrong, and then we plan for it. However, worry itself can be a destructive habit. When you worry every day, when you worry about things that are not likely to happen, when you worry about things that you can't do anything about, then it becomes a serious problem that impacts your function. So a certain amount is normal, but if it is excessive, if it consumes you, then it is a mental health problem.
Oh, okay, that's fine. So to some degree, you are basically saying worry is okay, it's good for life, it's good for us to maintain a normal life and what have you. We should not just brush it aside because it may be working something good in our lives. But it gets to a certain point where it then becomes worrisome. At that stage, maybe we need to do something about it. Now, are there levels of worry? Are there levels of worry? Is there like level 1, level 2, level 3, and what have you? And how different is worry from anxiety, if I may ask?
I think it's a different term for the same thing.
Mm-hmm.
And whether you worry or whether you're anxious, it's a little bit. It's the same thing. You look. Both of those things, the way we call it, makes you look at the future and makes you see possible problems that might arise and help you avoid those problems. So some people will say, I worry a lot, and other people say, I'm anxious about this or that.
Okay.
And what's interesting is our neurological network that works when we relax. It's our anxiety network, because that network has to keep us alive. So it has to see danger so we can react to the danger and avoid it.
Okay, that's fine. Mabel, do you want to say anything from a counseling?
Yes, I just want to add that at the first level, worry is a normal feeling that we all have and we need to have. It is basically being troubled or feeling troubled over actual problems or potential problems. Yeah. And you just have to feel apprehensive. It's normal. Yes. But then, as it has been said earlier on, when it becomes excessive, when you worry about this thing day in, day out, and you don't even sleep at night, then it becomes a problem. Then that's when it becomes an anxiety disorder.
Yes. How do you expect worry to disappear when the problem hasn't been solved? So how do I sleep when in my brain the problem is still there?
I believe that worry is basically in the mind. I believe it's basically in the mind, though eventually the body reacts to it. You can change things in your mind.
Yes.
You can begin to think differently about certain things. The things that trouble you, you can begin to view them differently, view them from another perspective. And then you can lessen your worry. Or you can begin to see positives in what you think is a potential problem. And then your worry will go down. But you can really work on your mind to decrease it.
Yes, and you know that there is a saying, and which is often displayed in class, which says, "God give me the serenity to accept the things that I cannot change, courage to change the things that I can, and wisdom to know the difference." So if something is troubling you and you are able to change it, then go ahead, work on it until you change it. If something is troubling you but you can't change it, as Sis Mabel has said, find a way of accepting or going around it so that it doesn't consume you and it doesn't hold you back in life.
Okay, I seem to hear the idea of being positive, the idea of trying to, if you cannot control it, and the serenity of knowing the difference and whatever. You seem to suggest that people have a degree of control over worry. Is that true? If people have got the degree of worry, degree of control over worry, why is it that some people worry forever?
I think Kebo said it very nicely just now. Some people develop a habit of worrying. Other people have got a personality style or makeup that tends to worry more.
Yes.
And then the high pressure that we live under pushes us to act and sometimes to become reactive rather than to think and then do.
Yeah.
And the nature of anxiety is such, it pushes us to find a solution, because the basic function of anxiety is that there's danger in front of me. I either attack the danger or I run away. So there's one or two answers. But in life, managing anxiety and controlling it is normally done by lots of small things that you do, and together they make you feel better. There isn't one magic answer you have to find.
Okay, I seem to hear that. Maybe let's go back to the clinical aspect of what we are talking about. This thing that we call worry and anxiety and whatever, when is it a disease?
You know, earlier on, you asked a question whether you have different levels of worry.
Yes.
Yes, you know, clinically that can be assessed. You know, there are tools that are used to assess the level of depression or the level of anxiety. So there are tools that are used clinically. But all in all, for our everyday life, look at to what extent is it affecting your normal function.
Okay.
If you can't, if you are so worried that you can't think of everything else, you can't get up in bed, you can't, functionally, look at how you function and how this particular problem is worrying you, then that is a disease, and that's an indication that you do need professional help. So look at functionally, when as a person, yes.
So are you saying, if I'm a manager at work, if I'm a husband at home, and if I'm a wife at home, and I'm a professor at work, I am worrying, but I'm still functional. I can feel I'm worrying. I'm restless in my brain and what have you. And are you saying, for as long as I'm functional, there is no need for me to go and seek professional help because I am managing my day-to-day life. When does one go and see a counselor, a clinical psychologist, or a psychiatrist?
I think, if I can just say, I think the discussion tonight should actually help us to do that, because sometimes you think that you are coping. You think that you are functional, whereas we've got so much pressure that eventually you just give in. So the discussion tonight should help all of us to look at this, and in the end have an indication of when should I go and seek help.
Yeah.
For me, anybody want to come in?
Yeah, I think in terms of your question about counselor, counselor, a psychologist, and a psychiatrist, there's a lot of overlap. The ability, the person's training to manage complexity of problems differs. So a counselor, if you're functioning well but you're bothered by your anxiety and you can't make changes yourself, then a counselor in most cases will be very effective. It can help you make those changes.
Okay.
The moment you become dysfunctional and you're starting not to cope, or your family complains, your boss complains,
yes,
then it's normally better to look at a psychologist or a psychiatrist. And then people always ask, where do I need to start? And in general, start with a place that's available.
Okay.
We as professionals are trained to assess people, and if someone needs the help, if they come to me as a psychiatrist and they need the psychologist, then I refer them on to the psychologist, and vice versa.
Yes.
So it doesn't matter where you start, just start at a point. Because
start at some point.
Yeah, because what Kibu says is so nicely, I often see people that have neglected themselves for years. So by the time they get to me and they've got anxiety as an illness, the amount of damage by their own use of themselves or misuse and pressure they put them under is so much. It sometimes takes us years to get them better. So, if you have high levels of stress, don't just accept that that's the way we have to live. You can make choices about your life.
You can.
Yeah. Yes. And as I said, I'm in health promotion. And health promotion is the process which enables people to take control over their lives. So even in mental stress or worry or anxiety, you need to have a way, to find a way, and usually this is working together with a health professional to find a way in which you take control over your life. That way, maybe learning to say no to things that are being piled on you, maybe learning to communicate better to people who harm you, or etc. But you need to have a way of controlling or having some control over what happens to you.
I just want to add that prevention is better than cure. When you do that, you prevent serious mental illness.
Okay.
You prevent developing an anxiety disorder.
Yeah.
Okay. Appreciate. All of us here are sons and daughters of the soil. We come from Africa here, and what have you. And I don't know what I'm going to say now, whether it does really make sense. But there's a lot of people who operate from that viewpoint. That look, when I have worry, anxiety, I have some episodes in my brain. The first protocol is I go to a higher power. I go to my God, or I go to Inyanga. I go to traditional healers. And that's so people from the African continent believe you don't just get worried. Maybe there is muti, you are being bewitched and whatever. No wonder when people come to pastors, the point is, Pastor, I have spiritual issues. Maybe I have spirits, I have this, or some people are doing this to me and whatever. How do we help African people in an African culture and the tradition and the religion to appreciate mental health and be able to separate it from spirits, from demons, and from all these things? Because to them, you are this because of this.
Yeah. Pastor, yeah, what I experienced there is that when we're under stress and we're worried, we tend to oversimplify things and we forget what the Bible says. The Bible is very clear that we made in the image of God. And God is so complex, nobody can explain it.
Yes.
And we are in the same image. So, yes, we live in a world that's broken. And our mental illness is a brain disorder. Specific problems in the body, in emotions, social life, or in your spiritual life can cause that. But if you haven't committed sin, why look whether this is a sinful thing? If it's the work that's causing it, that's not spiritual. That is social. And I think if people have the respect that our life is more complex and complicated than what we actually want to acknowledge. Yes, we all come from a different background. We all look at life from a different perspective. But the lives we live is physical, it's emotional, it is social, and it's spiritual. So illness also needs to be seen in that light and also treated in that light. I often ask my patients, and I say that with respect, is that we have a debate whether anxiety is a sin or not. But I haven't had a debate with a patient whether a full bladder is a sin or not. That we tend to see as, no, that's normal. We're allowed to have that, and we're allowed to go to the loo. But we're not allowed to suffer a mental illness. And we all immediately want to put that into the category of that's sinful, or lack of faith, or lack of prayer, or being bewitched. So for me, it's we are very complex beings made in the image of God. We need to respect that in the way we look at ourselves and the way we want to treat and manage ourselves as well.
Yes, and just to say, as people, we know that you can have a headache or a heart disease or whatever. The brain is an organ of the body. So it can be diseased just like the ear or the bladder or any other part. So that's how we should look at it.
Yeah. Right. I need some before Mabel comes in. I need some intervention here. You remember we're discussing in the behind the camera there before we came live and whatever. And you guys were telling me that worry tends to respond to external factors that are specific. Like if I'm failing to pay rent and what have you. So I worry when the rent is paid, then the worry disappeared because the specific problem has been solved. But then you were also telling me that anxiety is rather different. It's not so much caused by external events, but it is caused by events in the brain itself and whatever. This is where I want maybe our viewers to get a picture of worry being driven by external events, and then anxiety being driven by the brain itself. I like how you're putting it. I think you can also come on, but maybe Jerry, if you can help us on that.
Before Jerry responds, can I also say that anxiety can also be caused by external events? As an example,
yes.
If my husband abuses me,
yes,
when he's about to come home, I start being anxious. It's an external thing. So there's no dichotomy between, Thank you.
Okay, so there's no dichotomy, there's no difference between what
No,
causes worry and what
there's not a
causes
clinical line between this one is internal and that one is external.
Oh, okay.
Maybe if I come in there, Michael, I think it's an important point that Kebu brings up there. Anxiety disorder is when the brain becomes ill.
Yes.
So the anxiety neural network, it's a specific brain network that runs. That becomes abnormal.
Yes.
And it starts working when there's nothing on the outside that makes you anxious.
Okay.
So the definition is having a feeling of dread or something bad happening, but you're not sure what that is.
Yes.
So there's no external trigger to that. What Kebu really rightly points out is that a lot of people becomes anxious and they become ill because there's a specific external trigger. The husband abuses the wife. So when he gets home, she becomes anxious.
Yes.
If she then develops a mental illness and she becomes anxiety as an illness, that anxiety then carries through to other parts of life as well, and she becomes dysfunctional. And part of the treatment that we help patients look at is, when I feel anxious, is this the illness? Is this the brain causing it? Or is there something specifically that's making me anxious that I've got control over? Because the management differs. Because if my husband abuses me, then the way to manage the anxiety is to keep myself safe.
Okay.
If I just feel anxious when my husband is coming home and he's not a bad person, then I need to contain the anxiety and remind myself this is the illness making me anxious, not my husband making me anxious. So the treatment approach differs then.
Yeah.
Okay. I'll make a follow-up on that. Let's go back to Mabel. Rapiti, you wanted to comment on something?
Oh, I wanted to comment on African perspective, religious perspective, and all that. And I wanted to say, yes, I wanted to say, when we are worried, fearful, and anxious, we fall back on what we know. If we grew up in an environment where they explain issues in terms of witchcraft or whatever, then I will explain my situation along those lines. And if I grew up in a religious environment where they explain depression or whatever in terms of demons and all that, when I have that, I will explain it that way. That's why then it's important to promote mental health education so that people can understand that when there's anxiety or what, it is because of the changes in the body. And in treating this, medical treatment might be necessary, just as treatment of other illnesses is necessary. But when you are worried, there are changes in the body. Therefore, we bring in the medical perspective. It is okay to have the religious perspective, but it is also important to also have the medical perspective. Because when we have cancer, we do go to the doctors, but at the same time, we do pray. But then it doesn't mean that when we have a mental illness, then we must only pray and not go to the doctors. So we need education, mental health education.
Right. Look, I've had friends that have gone through situations, and sometimes even my very self. I don't know about the three of you. You are going through worry and anxiety and whatever, and somebody comes to your house and they tell you need to pray more. You are not praying enough. You need to fast, and maybe you've been fasting the whole 3 months, and they come on this single day, and to them, your illness, your challenge, your symptoms of worry and anxiety are a result of lack of faith. And how should we, if we are friends of people who are going through mental health challenges, how should we conduct ourselves in front of them? What view of these patients should we have, maybe given your religion and what have you? I've seen people that have told me, Pastor, you need to pray about this. And I tell them, I've been praying for this for the last 10 years. And what have you? Maybe there's something wrong with my prayer. So people get to a point where, they are no longer interested in God anymore because I've been praying for this and people are telling me to pray, but the problem is not going away. There is a listener right now, a viewer who is listening, who's been praying, who's been fasting, but nothing is changing. What message do you have for that one?
Let me just say, Ausmabel has already said that when you pray, being a Christian, we pray a lot and we believe in prayer and we believe that God answers prayer. But that doesn't mean that we don't go to the doctor. Okay. So pray, yes. And by the way, we don't only pray when we've got mental illness. Prayer should be our everyday thing. When we are happy, when we are, we should be praying anyway. But mental education is important so that people should realize that when something is happening, when you've got a headache, as an example, you can take Panado. But if the headache persists, then there's a need for you to see a doctor. So mental health should be, handled in that same way. But the other thing is, because mental health is mental disorders is a very complex issue. And, a lot of training needs to go there. A lot of people don't understand it. Therefore, let's refrain from diagnosing people and telling people what is wrong with them, because we may not know ourselves. Even the counselors, even Dr. Jerry as a psychiatrist, if I go to him and I have a mental issue, he depends on me to tell him what I've been through, what happened, etc. So you can't look at a person or you can't hear a story of a person and conclude that this person is not praying enough. It's very, very wrong. And so education is important so that we all understand this, and so that we become comforters of people rather than judges about their spiritual well-being.
Okay, let me take you back again. Okay, Jerry, you want to come in?
I would like, Pastor, I think one of the things that I find is that in all my travelings and being in different congregations, there's very little teaching in the church on our faith living with a chronic disease. All the teaching tends to be on, if I'm unwell, I pray, I believe, I get healed.
Yes.
We don't get taught how to manage our illness in context of our faith and the other way around. What I see practically, I see very ill patients. And the only reason why they're surviving and they've got hope is because of their faith and because of God's grace. So they're surviving and they're doing okay because of God's grace and because of the faith they've got and because of the prayer they've got. And because of that lack of understanding how to manage a chronic condition with our faith, when two people that are in church together, they believe similar, they do the same Bible readings, if one has a chronic condition, it makes the other one scared. What does it mean about my faith then? And then instead of people trying to understand and adapt their thinking and belief system, they rather reject the fellow faith believer and tell them, you're not doing the quick fix good enough. And so the problem is with you. And I think that complexity, again, within our spiritual belief, causes that kind of hurt that we do to each other in the church.
Remember, just to add, remember when Christ and his disciples saw the blind man.
Yes.
Was it a blind man or was it a crippled man? And they asked, who sinned? Is it him or is it the parents? The assumption there, spiritually wrong. That's why there is this outcome. So Christ actually rebuked them. for that. So when there are many things, because we live in a world of sin, there are many things that happen that are uncomfortable, that are painful, and we need to understand as people that we cannot explain each and everything that happens. Thanks.
Okay, that's beautiful. I need to start preparing ourselves to go to our viewers' chat box and whatever. And as we are migrating there, I've one question at the back of my mind, and I think I'm asking it on behalf of someone who is listening. Is medication a cure? Is it a cure, or is it part of the problem?
Well, unfortunately, yeah.
You go to the psychiatrist like yourself, Jerry, you give me tablets. I come, you give me 30 days, drink three times a day. I come, you load me with another basket of tablets. Are you solving the problem, or are you creating a problem for me?
I can do both. The reality is, our treatment doesn't cure at the moment. Okay. So the medication keeps an illness in the brain under control. But where it does cause problems is because if it gives you side effects, because it's man-made.
Yeah.
So sometimes the side effects are worse than the benefits. Yeah. So it's not perfect either. There's very seldom, if ever, that medication is the only answer. In some conditions, some mental illnesses, medication is 95 to 98% of the answer. But once you've got the right medication, then it becomes 1% of the solution, and your life becomes 99% of the rest of the solution. Mm-hmm. And that's what people need to understand, is that, yes, medication can be important, but it's very important that treatment just doesn't come through one modality. It's more than one thing that makes it better.
Okay, I appreciate that. Medication needs to be complemented by other interventions and what have you. Maybe, could you give one simple example, Kibu? Do you have anything to help with our medication? I'm getting antidepressants. What else should I do?
Dr. Jerry will tell you that when you go to him as a psychiatrist, he's not only dishing out medication, but he's also incorporating some behaviors. As an example, just exercise. Walking is one of the most effective contributory factors in terms of mental illness. Eating a balanced diet, resting enough, spiritual health. So it's a number of things that are needed for you to, as part of the treatment. It's not only medication. However, medication is essential for some people. They need that, but over and above the medication, they need to do other things like exercise, drinking lots of water, like having positive thoughts, like eating a balanced diet and avoiding some foods and things like that, and keeping a positive social network. If you have a mental disorder and your social environment is toxic, you're just going to be worse. So there are a number of things as part of the treatment. Treatment is not always medication only. It's medication and other things.
Okay, I'll ask one last question to the two of you, Jerry and Kibu, and then I come to Mabel, and after that we go to our viewers and what have you. Are there people who recover completely from anxiety disorders and become, like, in quotes, normal again? They live with no tablets. They've gone past the problem. Help has come. Is there such a thing as complete recovery, or these people will have to live managing this problem until they die someday?
I think Jen can answer that, yes.
I've definitely seen patients recover totally.
Yes.
The brain does recover.
Oh, it does.
Yeah, I've had patients that was quite unwell on medication for a long time, and then by bringing in a lot of other factors like psychotherapy with the psychologist, the spiritual life, exercise, the work-life balance, that they can actually come off medication, but they still have to be very focused on managing their anxiety.
Okay.
So some people are blessed that they can be healed, but unfortunately, the nature of that illness is that it tends to come and go. So some people may struggle for 2 or 3 years and then be better for 5 years and then have problems again. And some people are severely disabled by it. They need a lot of medication, a lot of therapy, and despite all of that, they still have a very big struggle.
Okay, I appreciate that. Mabel, just in case we have painted the religion with a wrong brush and causing people not to trust in prayer and the faith and whatever, I want you to give me an idea here. Under normal circumstances, is the belief in a religion a tool that we can use to feel better? Is prayer, life, faith, and whatever? Maybe in one line, what's your view of religion and mental health?
I believe religion plays a very vital role.
Yes.
Especially if you believe in God. I think belief is the most important thing. Belief and faith.
Yes.
That's why even in the Bible we find people who have been healed because of their faith. So when you have faith, you believe in God, it also goes to your mental makeup, the way you think. And belief in God and faith tends to relieve pressure, the pressure that is causing anxiety. You tend to be calmer because you take all your anxiety to God. So you don't have to worry. You just tell yourself everything. I've taken it to God. I don't have to worry. He knows better. He knows why I'm going through all this. So that very connection gives you some calmness, and you may recover quickly from anxiety.
Beautiful.
Can I just say one thing, please? By the way, literature definitely confirms that faith helps in all manner of illnesses, whether you're talking cancer recovery, whether you're talking depression, heart disease, whatever. Literature confirms that those people who have faith do better than those that don't have faith. Thank you.
That's powerful. At this stage, friends, we are going to our public chat box, and our engineers are going to give us the dialogue, the viewers' dialogue, so that we can begin to respond to it. I've got Fungi Rakwena Shabalala, who is saying, what really causes anxiety attacks in teenagers? A short answer to that one, please.
I think the teenagers of today are under a lot of pressure. So it can be that that there's too much pressure on them from school. Within the current situation, all the school changes with the pandemic and having to achieve high marks, being exposed to too much, not exposed to social media, exposed to too much social media, and being out of control. A lot of those things can cause it, and then unfortunately, genetics can also cause that. If an illness starts in adolescence, a lot of the times genetics also plays a role with that.
Okay. All right. Let's have another question from the public. We have Nathan Ngwaru there saying, do people's temperaments contribute to how one deals with mental issues? Temperament and mental issues, how do they play?
Definitely. Your temperament determines how you handle life issues. in general. So that is why some people can get easily annoyed because of their temperament, and others tend to get more anxious or more depressed because of their temperament. But not only that, there are also genetic issues related to them. Thank you.
Yes. Can temperaments be educated? Can we train them? Like if you are outgoing and easily irritable, can you train a temperament to behave the opposite or to be more calm? Or people are just naturally disposed to behave the way they are doing?
Let's hear it, Mabel. I think I'm interested to hear what you think, Mabel, with this one.
Yes, I believe they can be helped to deal with their temperaments, just as we are able to help people manage their anger. So
Yes.
even those with the temperament, they can be helped in various ways. Yeah, by learning to do this when they feel this way, and yeah.
Okay.
Yeah. Can I add there something?
Yeah. Yes.
I think one of the things that we don't like to accept these days is that some of our personality and our temperaments is who we are.
Yeah.
And they can be helped how to cope with it, but it doesn't mean they can change. So for some people, it'll stay a struggle, but they can be helped to learn how to manage themselves differently, even though they stay the same.
Oh, beautiful. Thanks a lot. Let's go to Farai Mutungwazi, who is saying, thank you so much for the beautiful study and talk. When is it concluded that someone is schizophrenic, put into a mental institution, discharged every now and then? Is it curable as they receive medication? Your take on that?
Yes, unfortunately, schizophrenia is not curable. It's one of the most serious brain diseases we have. It's one of the few conditions where medication is 98% of the solution. And it tends to be lifelong.
Okay.
The question is, how do we make the diagnosis? If there are certain set of symptoms that are present between a month and 6 months, most people with schizophrenia take at least a year to 5 years before they are diagnosed with a mental illness. If people take the medication, the illness can be under control, and then the rest of life comes in. The support, having a meaningful occupation, having a good spiritual life, but it is a more severe kind of condition.
Okay, thank you. Farai comes back again and is saying, is there a possibility that a woman may need medical attention, especially after giving birth, with serious mood changes, disorders, or is it a normal condition that may normalize with the time?
Yeah, can I answer that? Yes, Farai, this is what we call postnatal depression or postpartum depression. It is depression or mood changes that occur following childbirth. It is getting more and more common, and it does need professional attention. It's not something that can just go away. Sometimes the woman adjusts, but in the meantime, she's suffering a lot, and actually, it does affect her ability to care for her child. So it's something that is happening and that needs professional attention. Definitely professional attention.
Are there environmental factors responsible, or is it genetic also, or is it both?
There are many factors, contributory factors. Actually, it is one of my niche areas. Most of the contributory factors are social.
Okay.
Meaning whether you are employed, whether the baby is planned, and things like that. But recently, we also found out that people who have had adverse childhood events, like if you were neglected as a child, and those, or you were neglected or abused as a child, and things like that, when at the time that you give birth, you are more likely to get postnatal depression. Thank you.
All right, thanks. I appreciate that. Be thinking about this as we go back to Fungi. When a woman or a family is expecting a baby boy and they get a baby girl, or they're expecting a baby girl and they get a baby boy again, can this trigger depression, anxiety, or whatever you're calling postnatal depression?
It is definitely one of the contributory factors. When you, not for everybody, but for certain people, when you don't get a preferred sex of your child, that is definitely one of the contributory factors.
Okay, no thanks, Dr. Kibu. Let me go to Tem, because the lack of insight into an existing anxiety itself is a problem, as it can just take over the person's thinking pattern and functioning. It's not a question, but it's a comment. Mabel, do you want to come to that one?
Can you repeat? I missed it.
It's on the screen there. It says, knowing about the problem itself. Where is it gone? Okay, we have a new question there from, because lack of insight into an existing anxiety itself is a problem, as it can just take over the person's thinking pattern and functioning. It's just but a comment. How far do you agree with the viewer there?
I do agree. If there's no insight into the anxiety, it means you will not be able to stand up and seek help. You will live with it until it becomes an illness, and then that way your functioning will then be affected. But if you have an insight into anxiety, you will realize, hey, I have anxiety, let me do something. And then you will go to probably mental health professionals. They will help deal with the issue that causes anxiety before it becomes an illness.
Okay, thanks a lot. Thanks a lot, Doctor. There, the question seemed to have got one thing that I seem to have learned, among many other things that I've learned tonight, is we seem to be each other's doctors in the family or at church, and we seem to know what people are going through and the solutions they must have and what have you. While you're thinking about that, let's go back to Elizabeth Ngwaru. There it says, in terms of postnatal depression in PND, is there a way to help the significant others to be in a position to detect early these PND symptoms so that they can help, since the patient himself might not be aware of a condition? Anybody with an answer there?
Yes.
I think they are. Kebo, you want to answer?
Yeah, go ahead. Go ahead, Jerry. Yes.
Thank you, Kebo. The normal, when you have a baby, it's normal to have the blues on day 3. So you feel down, you feel tired, the woman cry, everything is sore. That's normal. Being unsure about how, what kind of a mother you are and whether you be a good mother, that's normal. But if your mood continues to be very down and depressed for more than 2 weeks, that's not normal. If you wake up not enjoying your baby, if you wake up not having energy or motivation and not eating, and the joy of motherhood is not there, that's abnormal. And then helping the mother see that and looking for help is important, because what Kibo says is very important. A mother that's depressed can't attend to a child on an emotional level like a healthy mother would. They'll give the child food and shelter and look after them, but the emotional connection cannot be made so well because the emotional networks in the brain isn't working well. So it's very important for the child that the mother gets treated.
Beautiful. Thanks very much. We have Nwapisa Pulumo. Is it possible to recover from childhood trauma? Anybody?
It's a very good question. We don't know the answer.
You don't know the answer?
Yeah,
I
think we may, yes, we don't know the answer, but I think what's important is that if you are aware of childhood trauma, something that happened a long time ago, and it still bothers you when you are an adult, then definitely see a professional. If it is still in your mind, it means you haven't recovered from it, you haven't healed, then see a professional to address that issue.
Okay, let me give a scenario to help the person who has asked their question there. If I was abused when I was 5-year-old and what have you, and then this was traumatic and I've lived with it over the years, is it possible to recover from that early childhood abuse?
Well, if you work with a therapist who can dig deeper, and if you can remember those instances, because for some at that age, they don't remember very well. And it's very difficult to really deal with that issue. But if you work with a therapist, the therapist can help you. But it's a long process. It's not, yes,
maybe.
lot of sessions.
Come in here. In terms of the complexity of us as human beings,
yes,
if you suffer severe childhood trauma,
yes,
it can cause brain changes that might not but never recover. But through working with therapy and also on your spiritual life, you can heal completely emotionally and spiritually, even though you might have scars that are physical. And that's the reality that, our healing isn't just on one level. Within us, the complexity of us as we are human beings, there are different levels that we can heal on. I've had patients that was sexually abused by the whole family. And they've got severe mental illness, lots of emotional scars, permanent scars. But on a spiritual level, they totally healed. And they're growing and they're strong. So it's important that we see that healing isn't just in one area of life. It's the whole complexity of us as people, as a person.
Yeah. Thank you.
Okay. Let's go to Nathaniel Ngwaru again, and he says, how can you tell when you or someone you love and live with has mental issues?
It depends on if you ask the husband or the wife.
Come again?
I said, depends if you ask the husband or the wife.
Yeah.
Earlier on, we did emphasize the importance of education about mental illness. When we are educated in the family, in the community, in the church, then the process becomes easier. And we are even empowered to suggest that how about seeing a professional? Whereas if we are not educated, if we don't have enough knowledge, you are even scared to say that because the backlash may be so severe. So it's important for all of us to be educated about mental issues, just like we know about high blood pressure and diabetes, and we should also be educated about mental health.
You have actually answered the question that Tembi Koza is asking. To what extent are mental health professionals educating the public about mental illness? Whose role is it? When I go to church, I am told you have demons. That's why you are behaving like this. When I go to traditional healers, I am told the ancestral spirits are not happy. When I go to psychiatrists, I am told these are mental health issues that needs to be. Are we doing enough then as mental health practitioners? And they're saying whose duty is it to help church members, ordinary citizens on the street to understand mental health and its dynamics?
The short answer from me is we are not doing enough. We are definitely not doing enough. And
Yes.
and one of the major contributory factors is that our health system and our social development are two
Yes.
different things.
Yes.
So Dr. Jerry will wait there until somebody comes to his office and say, I am not well. But what about the person in the street who
Yes.
has not come yet? So I'm saying, as a country, we are not doing well in terms of addressing population mental health. We're actually not doing anything. Thanks.
I don't know if I'm exaggerating while we are still there. I don't know if I'm exaggerating. I think I must have it from some radio. I don't know whether it's here in South Africa or in another country that we have 85% of people have mental health issues, but they don't seek help or they don't know and what have you. But come COVID-19, which comes yesterday, in 2 minutes, the whole earth, even 5-year-olds can tell you what a pandemic is, what lockdown is, and whatever. Why are we doing little to mental health? And yet, this is the engine that drives the economy, education, marriage, and relationships. Why are we doing little in that area?
It's one of the stigma points, Michael. The WHO mentions the lack of political will.
Yes.
That's worldwide. It's one of the big barriers to mental health improvements. So our politicians worldwide are not keen to push this.
Yeah.
It's again the lack of understanding and the lack of knowledge.
Mhm.
Just for interest's sake, in 2014, depression cost us 3 times more than the whole health budget cost us in terms of lack of productivity in South Africa. So our mental illness is costing us dearly. And it's one of those things that as long as we keep on talking, we'll push up the agenda. And what we're doing tonight is part of pushing up the agenda and making people aware of it. And
Yes.
hopefully influencing politicians to put more money into mental health education.
Definitely. Yeah.
Okay, thank you. Let's go to Nongeba Mokwena, and she says, are professionals able to distinguish between demon possession and mental illness? Are the symptoms the same? Are they different? How do you tell the difference?
A lot of time they are not. Remember, demon possession is a spiritual matter. It does exist, but so whether they're able to diagnose or acknowledge demon possession, it really has to do with your belief system. So there's a lot of confusion between demon possession and mental illness. So the general person, the general professional, a psychiatrist may not be able to distinguish between demon possession and mental illness.
Okay, this is why maybe at church then they find it easy to simply tilt towards the demon possession. Anything, oh, you have spirits, or you have this, and what have you. Saneliso Moyo is saying, if there are people who need professional help but cannot afford the costs, be it in public or private hospitals, are there places they can go to and get effective long-term help in South Africa?
Yeah, they certainly are. A lot of our public health clinics do have trained nurses that can help with that. At in Pretoria, like UNISA, and at Tikkies, their psychology department, some of the students that are specializing in psychology also do community service. It's part of their training under supervision, and they see people that have got mental problems, and they see them for free because it's a win-win situation. They get the training, but the people get the help as well. It is more difficult to access it sometimes, South Africa, depending on where you live.
Okay.
But again, if you keep on looking, you will find some way to get help. Don't give up just because it's difficult sometimes. I've had patients that have been struggling for 4 or 5 years before they got help. So don't give up.
Okay, Saneliso is saying, she just posted there to say, I mean, getting help at no cost. Are there places that people can go and be assisted at no cost as far as mental health issues are concerned in South Africa?
Those I've mentioned now are those that you can, get without cost.
Okay.
People, in terms of your public health experience?
They're actually almost non-existent, other than what you are saying. Unfortunately, in South Africa, we have not invested in mental health, even in education. So it's something that we are still working on, but it's very limited.
Okay, thank you. Let's go to Nwabisa Pulumo again, and she says, or he says, how is one who's staying? How is one who is staying with the person with the depression able to with the depression are supposed to respond when the person goes to their switch off or mood zone? If you are staying with a depression patient and they then switch off or they get into their mood swing, how should you deal with that?
Can I say something? If mental illness is not limited to the person who is affected, it affects the whole family. Yes. And so if you have someone in your family with mental illness, you need to learn, you need to be educated about it. You need to know the symptoms. You need to accompany this person when they go for counseling so that you understand the process, and then you'll be better equipped to assist, support, respond. Thank you.
Thank you. I don't know if this is going to be our last comment, and then I will ask you to summarize the event for today. We go back to Elizabeth Ngwaru, and she says, many church members, when having worries, seek help from their pastors, and the pastors pray with them. Will there still be need to seek professional help, or it's a lack of faith?
This I think I'll say, I think you had addressed it earlier. Maybe you can just repeat what you had said earlier.
What I believe in is that with any other type of illness, prayer is important. You go to the pastor prays with you with any other type of illness. So the same applies to a mental illness. You do go there, but then that's not the end of the story. If it is necessary to seek medical help, you then have to go to the hospital. You have to go to see a doctor. Even with mental health, you have to go for medical assistance, or you have to go to a psychologist.
Okay.
So prayer does not exclude other methods of intervention.
Yeah.
And on that score, Pastor Ngwaru, I think we also need to, part of the education means that pastors should also acknowledge that there are things that they cannot handle, and therefore they must refer. I think that is important.
Yeah.
Yes. So a pastor who is not trained in clinical psychology, in counseling, you must appreciate your limitedness in handling people's situations. That's what I'm hearing from you.
Yes, but also remember the majority of pastors are not trained either in clinical psychology or in what. They are just pastors. They know the Bible, they know the theology, they are doing it very well. But what I'm saying is they must acknowledge that there are certain things that they cannot address adequately. So they must learn to refer. Thanks.
Okay, thank you. Okay,
I'm happy that some churches are realizing that, and they are organizing training seminars for pastors. Like the Adventist Church, it is often training pastors on mental health.
Okay. Oh, beautiful. Yeah. Okay, I'd seen earlier on a comment from Machaka, Millicent, commenting on the fact that we have started on the right course by addressing mental health even on this platform. And yes, what she says, Machaka Ravengani, she says, I guess forums like this one is a good starting point on mental health education. And I really commend the host and panelists. We appreciate your comment, Machaka. We are moving together with you and everybody else. We really appreciate that. And then another comment from Elizabeth as we wind up. On point, Dr. Kibu, pastors need to acknowledge their limitedness and refer to professionals and what have you. Thank you, Elizabeth, for that comment. Now, as we sum up, Mabel and Kibu and Jerry, if there is someone who is a patient of anxiety and maybe somebody is going through worry right now, and they have taken all the risk to listen to this program, not knowing what we were going to say. And as we wind up, what would be your message of hope to that person? Anyone wants to start as we, please, in just less than a minute, what is your take-home message to someone who wants to hear a message of hope with their anxiety and worry? What are you saying to them?
My message would be that you need to seek help. As an example, the SADC. SADC is the South African Depression and Anxiety Group. They can be accessed through a telephone. You can call them, you'll get counseling telephonically, and then they will advise you if you need further attention. But I'm saying don't sit back and not do anything. If you do have anxiety or depression problems, do something. Talk to a professional. If you don't have money, try the UNISA psychology department, which Dr. Jerry has said. Call SADC. Do something. There is hope. There is help somewhere. Thank you.
Thanks, Kibu. Someone else?
And if you have money, there is Vista Clinic.
Yeah.
Okay. Avoid to go commercial on this program and what have you. Anyway, it's already been said. You can go to any other mental health clinic apart from Vista Clinic that can provide the same. We really appreciate that. Dr. Jerry?
I want to echo what the other panelists said, is that keep on looking and look for small solutions. You don't have to find one big solution. Every small thing that you do helps control the anxiety and makes you grow as a person and makes you enjoy life more. And then if you can't do everything on your own, get help from outside. Family support. Remember, there's lots of wisdom in the support of people around you.
Yes.
And if you've got a good pastor that prays for you, tell him not to stop praying for you, because prayer does make a difference as well.
Thank you, my panelists, Jerry, Kibu, and Mabel. What a night it was, and thank you for sharing hope. Thank you for sharing information. I am sure we will call you one more time to go to follow up discussions on mental health. This is just but the beginning, but I'm sure there's still a lot to share. And to our viewers out there who've been hanging around with us, we also want to thank you. And let me share with you our vision of this platform. Our vision is to make this platform an educational channel of choice, where people are helped to adjust to life, manage life, relate well, heal, and move forward. And even if there are certain life conditions that do not change, but your way of dealing with them, the way you look at life, may in itself be healed and change, and what have you. And always reminding you that God is in control, God is with you, and your family members are with you. You are never alone. I like the Liverpool slogan that says, "You never walk alone." In this world, there are some people who are willing to walk with you. Don't shy away from people, walk with everybody else. And to help this ministry, to help this platform grow with each day and to reach many, many people, would like to request you to like and also to follow us on YouTube and also on Facebook page, and also to subscribe and to share. Until next week, on Thursday, 7 p.m. usual time, may you have a sweet night and may God bless you. Have a sweet night. God bless you all. Thank you.
Thank you.
Thank you.
Good night, everybody.
Good night.
Thank you. Good night.